Kim Liana Pabustan and I'm back again here at CSA Medical Aesthetics. 2 weeks ago, I visited here for my under-eye PDO threads by Dr. Contessa to alleviate my dark circles and now to further improve my eye area. And now, Dr. Contessa will conduct a temple fillers here kasi napansin ni Doc na medyo malalim na yung part na to. And before anything else, don't forget to like, subscribe, and hit the notification button to keep you posted or updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Kim Liana.
Hi!
Yeah, we did under-eye threads 3 weeks ago. And look at her right now.
Yeah.
Goodbye concealer na talaga, Doc.
Correct. Yeah, I can see a big improvement. Okay, it's just 3 weeks. And we already noticed the elevation of that sunken under eye region. Plus, there's a smoothness in the junction between the lower eyelid plus the upper cheek. So we were able to correct volume loss, also like a darkening under the eye, and also the good skin elasticity. Okay, so all of the above, right? And the thing with that, the PDO threads will still synthesize new collagen, elastin, and other skin tissue network. There you go. So for today, since we're doing a follow-up, I was also doing an assessment on the face of Kim. A while ago, I was checking. Actually, we're still on the upper third, right? Upper third of the face. I was checking on the temple region and the lateral forehead. And I noticed, she's just 23, she has this beginning volume loss in the temple area. And I think Kim also noticed that,
Yes.
right? Yeah. So this part, Kim, ideally there's this normal fullness of that temple. For women, ideally we should have that good bitemporal width balanced with our bizygoma width. Okay? Now, if you're noticing that your bizygoma width is wider than your bitemporal width, then you're starting to have the so-called volume loss in your temple region. And once you have that volume loss, so you're noticing like a sunkenness, hollowness, and you're like starting to notice the bony landmarks. So like your temple fusion line here or the temporal crest, even the lateral orbital rim, even the superior border of the zygoma, they will be noticeable. So when this becomes more sunken, the more you're gonna see those bony landmarks. That's why it's very important that if you start to notice this, do something about it. Okay? Prevent already the worsening of the problem. And another thing, once you have that volume loss in the temple, the tail of the eyebrow as well as the corner of the eye or the upper eyelid will begin to sag or they will fall down. because of that lack of volume here. So there's no like tissue support, nothing like lifting your upper eyelid. Makes sense, Ma'am Kim?
Yes.
Right? So that's the thing that we're gonna work on for Kim right now. And another thing, because her face is more of the Caucasian side, okay? Because Asian women, we have this like rounded shaped face or like a shorter face and a wider face. Caucasians, they have like an elongated and a narrower face. So I'm looking at Kim, so she's more on the Caucasian side. For the Caucasian shaped face, elongated and narrower, so it's important that we correct this lateral aspect of the face. So from temple to the zygoma region, okay? I'll also be doing a so-called like the inverted triangle treatment or the triangle of youth treatment for Miss Kim, okay? So like working on the temple, working on the zygoma here, and the center, the chin. We'll be doing an assessment of that. We'll show you when CSA Medical Aesthetics return. And we are back. So we'll continue with the assessment that we were doing on Kim Liana here. So we mentioned that there's temple hollowness, okay? And then as we go in the mid-face section, I was assessing the zygoma region, Kim, okay? I was also noticing a beginning sagginess here on the nasolabial area. And the reason is because there's a beginning volume loss in this mid-cheek region. Okay, I was noticing a while ago when you were upright that this part of your face, this anterior cheek area, there's a beginning droopiness, ptosis, sagginess. Then going on the lower third of the face, actually we also noticed a facial asymmetry, right, Kim?
Yes.
Yeah, so this side here has more volume as compared to this side. Okay, so that's gonna be our next goal, how to improve or correct facial asymmetry, okay? And then as we go into the center of the chin there, there's a good chin length also. But if we can assess some projection of the chin using our Ricketts E line, okay, a little bit of some deficiency, just a little bit. So what I'm gonna do as part of the inverted triangle or the triangle of youth is from the center of the chin towards the corner of the mouth to the zygomatic prominence towards the temple, we'll be doing a treatment for Kim Liana. Okay? So, make your markings. Okay, I need a ruler and the center will be this chin part here. From this part, the inferior aspect, we'll make a diagonal line. So, from this to the corner of the mouth, okay, from the corner of the mouth, going upwards, because Kim Liana is more of a Caucasian. Do you agree? Disagree? You're more of the Caucasian side, right? And because Asians, we Asians have this round shaped face, we have this wider shaped face, we have like a shorter shaped face, but for Kim, she has like a longer shaped face and a narrower face, which is good, right? Because the ideal face shape for especially women, we wanted to have that oval. Okay, that's the ideal one originally. But right now, they're saying a V-shaped face. If I may ask you, Kim, what is your ideal face shape for you, in your opinion? Anything? Like, of course, for women, yeah, trend V-shape, yeah, exactly. Okay. So for the temple region, I still wanted to palpate for the temple fusion line and that lateral orbital rim and then the superior border of the zygoma, okay? And to be safe here, I'll do a 1 cm perpendicular to this temple. So usually 1 cm or your 10 millimeter range to be exact if you want to make your measurements, and then perpendicular also to your lateral orbital rim. So I'm trying to make a marking for the safe zones where I can do my injections, okay? So usually I also says for the highest point of the eyebrow there, and make a horizontal line towards my hairline there. And I already have a marking of my injection points here and my injection points there. This is one is, and I borrow the ruler again. I can measure 1.5 to 2 centimeter from the lateral canthus, and that's gonna be the injection point for my zygoma region. So, what do you think are we going to use, Liana? Any idea in your mind?
Hyaluronic.
Yes, she's so good, okay? So, to correct volume loss, improve those depressions, hollowness, or sunken areas, we need a filler. And the filler that we will be using is, of course, hyaluronic filler. And hyaluronic filler, as we all know, is naturally present and it's very safe, well studied. We already had done a lot of hyaluronic injections all over the world, and there's been a lot of papers, scientific data, scientific reports on these kinds of treatment. Right, Kim?
Yes po. Doc, I want to know po, ano po yung, what causes po yung hollowness or yung sunken temple po?
Okay, that's a very good question. What is causing the volume loss on the temple region? I'll give back that question to you. What do you think is the cause? Since we've discussed a lot of causes in the under eye region, the sunkenness in the under, what did you remember?
Siguro aging din po.
Yes, the most common cause is the aging. Okay, as we age, we have this so-called volume loss. So when aging strikes, they were saying that aging starts at 20s. And Kim is 23. Okay, so there you go. So aging is a factor for the volume loss, or those tissues that shrink or atrophy or decrease, they decrease, okay, over time. Imagine, no? Over time. So our face morphology really changes as we age. That's why if you have like others who have like implants, yung mga permanent implants. So if your face is changing, morphology changes, shape changes, bone changes, tissues change. So those kinds of implants may not adapt already to the change. That's why some people like prefer the natural materials, natural products. So I now have my markings. So now hyaluronic is the one that we will use to fill in the volume loss. So volume loss from aging. Now another one, cause, genetics. Well, in some people may have this like they were born with sunken temple. So that's something inherited, okay? Now, something acquired, probably trauma, accidents, okay? Developmental abnormalities, those are some factors, okay? And then some people who will lose weight or like had weight loss, diba? Some people who are into a certain like a diet and exercise and then they lost weight, kind of like their face will become more sunken. So some proteins there are also depleting, okay? That's why those who have done a lot of workout and then a rigid diet, okay? So some of their soft tissues, more particularly the fat tissues. The fat tissues are the one that will shrink, okay? And shrinkage of the fat tissues, usually they start to notice it in the mid-face. That's the first one. And also on the temple, you start to notice fat shrinkage. And then the fats tend to go down here. That's why we have this jowling. That's why it's called pyramid of age as we age. So you invert, your triangle becomes pyramid of age. The triangle of youth becomes pyramid of age. Did I answer your question?
Yes po, thank you.
Okay. So, after that, okay, anatomical layers, when you do your filler injections, safe zones, as much as possible, we want to stay onto the bone with the needle method that I will be using. So here, supraperiosteal, supraperiosteal, supraperiosteal. So those are in the anatomy, and avoid important blood vessels. So okay, here we're not injecting here. But in this part, we have to avoid for the superficial temporal artery, middle, and deep temporal vessels. So injectors know those. And here, if you're gonna inject in the zygoma, of course, avoid the infraorbital structures here, and zygomaticofacial, zygomaticotemporal, zygomatico-orbital, okay? If you inject in the chin, avoid, of course, mentalis structures there, mentalis blood vessels and nerve, okay? And submental artery also from your facial artery. Anatomy. Okay, now, product. So we'll be using hyaluronic dermal filler. For this kind of volume restoration, we'll be using the so-called Hy-G prime filler. Something to give also projection, lifting, and restoring volume. Because fillers have different rheological properties. There are several kinds of fillers, okay? So your injector should know what specific filler to use in a specific anatomical region, okay? So that's the product. And then in terms of the technique, I'll be using a needle, a bolus injection only onto the supraperiosteal layer only. Okay, let's start with the treatment. So we'll start with the filler injection. I'll be working on the temple first. So before any treatment, you do your cleansing, you disinfect, and then you may apply your topical numbing cream. And then after that, so we did our landmarkings already. And I'll start with the temple region, needle method, bolus approach. So here, I'll be injecting about 0.5 ml of my hyaluronic filler. Now, I am on the bone, so it's a perpendicular direction. I usually aspirate. It's my habit to aspirate and wait for a few seconds. Now, if there's a negative backflow there, and I start to push, and pushing is a slow rate only. We're not in a rush, especially you're doing the temple section. Actually, here the superficial temporal blood vessel is palpated near the hairline region. That's the normal position of the STA here. And actually, I am palpating that pulsation. It's over here on my non-injecting hand. And I'm already pushing, and I wanna fill in about 0.5 ml of my product here. As to the amount of how much you're gonna inject, it will depend on how sunken the area is. So if it's like a mild to moderate, like around 0.5, 0.8. But if you notice that it's really severe, it's really very hollow, you may add. You can even use 1 ml on each side, okay? So slow push only and onto the bone. And my goal is to restore the volume as well as lift the corner of the eye, as well as the tail of the eyebrow. And we're gonna restore the fullness of the temple. You're okay, Kim?
Yes po.
Okay. So the good thing with the product is it's a hyaluronic filler with lidocaine. So it's also it has lidocaine incorporated in it. So we're just pushing in slowly until I reach that 0.5 mark there. And almost, I just need a 0.1 to complete my product. Okay, so we're working on the temple region. Next will be my zygoma area here. So press on the injection point, pressure, so disinfect. So I already have a marking there. So the goal here is to improve that depression in this zygoma region. Okay, you want to fill in specifically the so-called zygoma prominence there, or the malar prominence, and I'll be injecting about 0.2 to 0.3 of my product here. And this will give a lifted cheek region and restoring also your cheek's OG curve, as well as reducing your nasolabial fold. So this will also be very good for lifting the cheek region if you're starting to notice some cheek ptosis or cheek sagginess. So improving your cheek mid-cheek groove. Okay, there you go. And finally, on this side, I'll be also injecting the apex of the chin. Okay, we just wanted to improve the so-called anterior projection. So we'll target the chin apex here, the symphysis menti, onto the bone, and then aspirate a bit. So I still have a 0.2 on my syringe here. and just bolus injection your perpendicular onto the symphysis menti. Okay, we're improving the projection of your chin, and almost done there. 0.2 mil, and there you go. Let's proceed to your left side. How are you feeling, Kim? Still okay?
Yes.
Okay, so the next syringe. So for the entire treatment, we are using a total of 2 mil to improve temple hollowness, also the lifting of the zygoma region, as well as projection of our chin, and disinfect the region. Okay, and I already have my marking there. You can also make a habit of like lifting the skin here, pulling it up like that, and injecting into that area where we did the marking. It helps if you have that marking. And I'm already onto the bone. Aspirate a bit, wait for a few seconds. 3, 2, 1, and 0, and then push slowly. Again, we wanted to fill this in with about 0.5 ml of my hyaluronic substance, which is a high G prime. You need a substance that's more of a viscous one, thicker one, or high molecular weight, or a large particle. So since it's high molecular weight, when we push it through that gauge 27 needle, there's this like resistance. So you have to have that much of an effort to push it. Pushing with your thumb and filling in that temple area. Okay, avoid your superficial temporal artery, the middle temporal vessels, deep temporal vessels. Okay, so this is just correcting our volume loss on the temple region. Kim was telling me a while ago that it's more on the right side.
Yes.
So later on, we'll be doing a so-called assessment, a so-called balance check. And if we need to add more on one side that has more of a volume loss, we can still do that. And proceeding to my left zygoma, okay? So I already had the marking there, injecting onto the bone, okay? And then aspirating, wait few seconds before you inject. I'll be needing like around 0.2 to 0.3 in this region, and pushing gradually. So it's normal to feel some like gritty sensation there, and you can hear the push of the filler, right?
Yes.
Yeah, that's expected. So later on, we'll do like a balance check if one side will need more of a volume, because whenever we do assessment of the face, we notice asymmetry. One side can have more of a volume loss, one side can have less of a volume loss. So this is just adding a little bit more here, and we are done with the treatment. So almost about to finish here. Just a little bit more, a little bit more. And actually, I am just using on this left side about 0.8 ml, and we'll check when we need to inject more on the right. And after this, we'll show the result to Kim when CSA Medical Aesthetics return. And we're back, so let's show the result to Kim. Here's the mirror, Kim. Okay.
Wow.
Right, yeah?
Grabe.
Simple technique, but there is a result.
No bruising.
And no bruising, exactly.
Instant, effect na, no?
Instant effect, yeah. I already noticed a fullness on the temple region, and the mid-cheek part, there's some lifting already, and the projection of the chin, okay?
Yeah.
So with that technique, just following those lines, you can do an improvement, a lifting, restoring volume, doing projection with the help of our 2 syringes of hyaluronic dermal filler, and a simple technique of needle method with bolus injection on top of the bone. So for women, no, like we love doing like contouring, right? Like we highlight on the cheek area, the cheekbone, and then also some will do like a highlighting on the chin, correct? And then highlighting like upper third of the face, right? So it's like the contour makeup too, okay? So I also noticed like the tail of the brow and the upper eyelid, it was lifted. So your eyes were opened.
Actually, Doc,
Right?
pati yung sa cheeks ko napapansin ko po
Yeah.
when I take photos.
Yep.
Parang
Sag.
sagging
Exactly.
po yung skin, yung
Right.
cheeks ko, ganun.
Yeah.
Pero ngayon, parang,
Usually when we do assessment of that sagginess, we tell our client, so side view, we take a picture side view and look down. You may look down like that, and if you're noticing already, like this lower cheek region, if it is going down or droopy, there's already a beginning sagginess or ptosis there. So that's already a beginning sign of aging. Okay? So for now, I already noticed that on the profile view, if you're gonna check the profile view, you restore the natural OG curve of your cheek. So for like Asian women, usually we have flat cheeks when we look on the side. Ideally, we should have that good cheek projection. It should be in a convex shape, okay? Convex. Then also on the chin region, same thing, convex shape, chin projection. So cheek, chin projection. And then on the temple, so on the temple frontal view, the bitemporal width together with the bizygoma width, it should be within that straight line or that vertical line. So we were able to do like a balancing of proportions, the vertical fips, and then we did some lifting, and we were able to open your eyes, okay, like lifted tail of the brow, lifted corner of the eye, and kind of like revitalize the eye area again, because we did already 3 weeks ago the under eye region. So no more tired look, no more haggard or stressed look, but more refreshed, revitalized, more youthful. At the same time, you're of course preventing the signs of aging, right? Thank you so much. Was
Thank
it
you,
painful?
No pain at all, Doc.
Right.
As in, yung naririnig ko lang, yung sinabi, which is
Yeah,
normal though.
it's normal because whenever we push that filler, somehow like you're hearing the gush of the filler product. Okay. Thank you, Kim.
Thank you, Doc.
Yeah. Do you have any question about your experience? Can they reach you?
Yes, you can message me po on my social media accounts, Kim Liana on Facebook and on Instagram, Kim Liana DP po.
Yes. You may also message us at csaskinclinic@yahoo.com, our email address. The Instagram, CSA Medical Aesthetics, FB, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. If you've missed the previous episode of Kim, you may watch it at our YouTube channel, Contessa Salvador. And please click the like and subscribe button. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.